Senator Warnock of Georgia is recognized.
Thank you so much, Chairman Brown. Director Chopra, great to see you again. Thank you for the work that you are doing to protect the people in my home state of Georgia and all across our country from deceit and fraud perpetrated by bad actors in the financial industry. According to the Kaiser Family Foundation, nearly 1 in 10 adults, or roughly 23 million people, owe medical debt. And as of 2020, American families collectively owed over $140 billion in medical debt. In Georgia, there's over $120 million in medical debt for over 100,000 people. Last month in this committee, we heard from experts that people in states like Georgia that have not expanded Medicaid suffer from higher medical debt, not surprisingly. What state you live in should not determine whether or not you have access to free or affordable health care, or whether or not you are forced deeper into medical debt, but that is the situation we're in right now. That is why I introduced the Medicaid Saves Lives Act, and it's the reason I'm fighting to close the coverage gap to ensure that everybody, everywhere, is able to see the benefits of Medicaid and to receive health coverage. We're talking about a law that's been on the books now for a decade, and making sure people have access to health care through the expansion of Medicaid. Director Chopra, in the CFPB's work on medical debt, is there a difference that you're seeing in debt burdens among residents of states that have expanded Medicaid and states like Georgia and the other 11 states that have not?
So, Senator, I don't have that analysis offhand. What we do know is that for those who are uninsured, they're much more likely to have higher levels of medical debt and more likely to, I believe, have collections items on their credit reports. And I'm happy to check with you on that. The big challenge, I also think, is that much of the medical debt that appears on credit reports may not actually even be owed. In many cases, these individuals may qualify for certain charity care under the nonprofit rules that hospitals have to adhere to. In some cases, they may benefit from their own insurance that they may have. And so we need to make sure that credit reports are accurate and not used as a weapon to coerce people to pay debt that they don't even owe.
I would agree with that, certainly. But would you agree there, if people are less like, if they are not covered, they're more likely to be in debt? So that would obviously include people in states that haven't expanded Medicaid, that don't have any kind of coverage, and they would be more likely to have to resort to high interest credit cards. Are you seeing that in your work?
That's right. So in some cases, actually, medical debt is even blocking people from getting care altogether. I'm particularly concerned that inaccurate medical debt reporting is actually preventing people from even being able to pass an employment verification check, to be able to pass a tenant screening check, to be able to get credit. The credit reporting system has serious issues with accuracy, and medical debt is high among them.
Right. So because of lack of access to care, lack of coverage, people find themselves in medical debt, which also impacts, as you point out, their credit reporting, impacting employment. So they're caught up in a cycle not only of debt, but unemployment and a whole range of other cascading issues. Is that?
Yeah, and after you get sick, you should want to be able to get back on your feet, to get back to work, to move to a place where you can be near your job, to be able to rebuild your life. And for many people, they're so frustrated that they also felt, I already paid this, or I never even got this service, or this is sitting with the insurance company. People are going nuts over how to deal with this, and it's harming people.
Yes, I appreciate your observations there. I think that healthcare is a human right. And obviously, if it's a human right, it's not a human right in some of the states. It's a human right in all 50 states. The Affordable Care Act has been on the books now for a decade. And the situation is that people in states like Georgia who find themselves in the coverage gap are more likely uh, to be carrying this huge medical debt. And so I look forward to working to make sure that we get health care passed for all Americans. I see that our chairman is not here, and I want to call on my colleague from the state of Maryland, Senator Van Hollen.
Thank you, Senator.